The next exercise is the static prone plank. Now we're going to increase the abdominal loading by going into a prone position and having to perform a bridge. Now again, this is going to increase the load on the external abdominal muscles, but we have to keep track of what's going on with the deep stabilizers. So make sure that you're going through the exact same steps as that I've outlined previously, drawing the belly button up and in, and making sure you lift your chest up and you're breathing properly to avoid excessively recruiting the outer abdominal wall so that those muscles are bulging out. You do not want that. So I have Allison laying down in the face down position. As she just moved to, you're going to start with your elbows propped up underneath your shoulders, and your toes are going to be underneath you. I'm going to have her actually start on her knees. So I'm going to have her lift up. Okay? Now from this position, it's easy to be able to address the pelvic tilt. So from here, she's going to tuck her head down, and I'm going to put the stick on her. And now, with this exercise, the problem with the stick is putting it on yourself. When you have somebody else to help you, then they can do so here. But with the other exercises, with the opposite arm leg raise, you can put the stick on yourself. It's not a problem. It's a little bit more challenging to do here. I suggest somebody else doing it for you. Although if you don't have the stick, then that's fine as well. You can still do the drill. Now, I'm going to have her align herself in the exact same way as we did during the 4-point position, only her knees are behind her. So we have a little bit of a gap here. I want her to decrease that just a little bit. So we should be able to get the hand right in between the lumbar spine and the stick. Her head, mid-thoracic spine, and the sacrum are all touching the stick, which is where we want to be. Now for this, as I've started her here because it's easy to correct the pelvic tilt. Many people try and lift from the floor or the table straight up into the plank. I frequently find that there's problems with that because they aren't able to make the pelvic corrections in the top of the movement because now the abdominal load is significantly higher. You want to get your body into alignment prior to getting into the plank position because then you don't have to make any corrections when you're there. So the stick is on all the correct positions. She's got her belly button drawn up and in, and without moving anything in the spine, all I'm going to ask her to do is to straighten her knees up. She's going to hold for 5 seconds, as you see perfect alignment. 2, 1, now just drop the knees. And again, we don't move from this position. It's easy to just lift and then drop in this position, and you don't have to keep making the postural corrections unless you're losing your alignment. So again, belly button up and in, as she's held her breath. 5, 4, 3, 2, 1, and break the lock in the knees. And you can rest down. So as you can see there, the main component is being able to recycle the repetitions over and over again. So remember that your posture and your alignment is everything, and all of these exercises has been very similar in terms of keeping your body alignment upright. So if you had good posture in a standing position, if I put your elbows out in front of you and then laid you horizontally, that's exactly what the plank should look like. And your key point is recycling through all those steps, breathing in, drawing the belly button up and in, tucking your chin, lifting and lowering. This is a very challenging exercise, especially for back pain sufferers, so it's advisable, of course, you should have been going through all of the other exercises prior to initiating this one. Now, if you have back pain during this drill, a couple of things could happen. Either A, you don't have enough pelvic tilt, so it may be necessary in order to encourage the abdominals to do a little bit more work to perform more posterior pelvic tilt. And what this would look like with the stick is that the lumbar spine touches the stick. That's okay to do in this drill because you want a little bit more abdominal muscle activity if pain is present. A lot of times it's because the abdominal muscles aren't doing their job and the back muscles and the multifidus is starting to contract and it's getting fatigued. So reducing some of that lordosis and making that stick, the lumbar spine flatten against the stick can help. If you're still having problems, you can reduce the time, although the beginning exercise prescription is 5 seconds on, 10 seconds off for 10 repetitions. Although you can just lift, hold for a brief second, and then lower again to reduce the time that you're holding the position. Either way, this is an integral position that you need to learn as an exercise in order to do further exercises. If you can't do this exercise appropriately for conditioning the abdominal wall, you are not ready to move on. So it's imperative that we're able to get through this exercise and to be able to do it correctly. So there are a number of components here, and most people will get the teeter-totter aspect of the thoracic spine on this one as well. So it's important to make sure that you're focusing on one thing at a time, and number one, since you have back pain, is the pelvic tilt. The pelvic tilt needs to be in the correct spot, and then you can worry about the upper back and then the neck a little bit later. But do your best to keep the chin down and to keep everything in alignment if possible, although I realize in the beginning for some people this is a very strong challenge to do. So with this, we want to start with 5 seconds on, 10 seconds off for 10 repetitions. Then you can quickly progress to 10 seconds on, 10 seconds off for 10 repetitions. A third progression would be 10 seconds on, 5 seconds off for 10 repetitions.